welcome to another episode of On the Mic with Ed. You are here with myself, Maria Ortiz, and co-host Dr. Zoe Ross-Nash. We also have with us today Mary Elizabeth from Alsana, and we're going to be talking about health at every size, weight stigma, all of those things that enter into our space as eating disorder clinicians, and we're very grateful to have her here with us. So I'll let Zoe thank our advertiser.
Yes, actually a very special podcast today because our advertiser is Alsana and we have someone speaking from Alsana. So we're very excited to learn more about the very company that supports this podcast. A little bit more about Alsana is that they are an eating disorder treatment center with locations in both California and Alabama. And then they have virtual IOP options as well, if that is something that you're needing. And that is accessible all over the country. But we are so excited to put a face to the name and talk about health at every size and weight stigma within the therapy room. So thank you so much for being here.
Yeah, thanks so much for having me. I'm happy to be here this morning.
Awesome. Mary, would you like to share a little bit about yourself, what you're hoping to get across on this podcast today?
Yeah, absolutely. So I have been in the eating disorder field almost 11 years at the end of the summer. And I got into this space because I'm recovered myself. And so, it's just felt really important to me to be able to be a human that's able to give back to the space, right? I always think of it as like getting to be in the other chair, like I think about the people that were in that chair for me and my experience and just like what a privilege and honor it is to be able to like sit in that other space is such a gift. So and I love the treatment world. I love helping people through this chunk of their recovery process and getting to be a part of that bigger picture for them. And for me, the topic we're talking about today feels really important for a lot of reasons, but it hits really close to home for me. So, like as a recovered person in a larger body, I think there's been a lot of continued work in my life on this idea of like body neutrality. And I don't know, maybe I would say like the grief of what it means to live in our world and in our society in which like my body is not accepted like in this time and age, right? It is not what the world wants it to be. And so how do I take that, receive that, own that truth, and yet still live out my life, right, in a recovered space? And I just know that there are so many individuals who are in my shoes or like, or, are walking that out too. And so it just feels really important to talk about.
I love that perspective, and thank you so much for sharing that part of your story with us. We're
Yeah, of
very
course.
grateful to have you in this space, but also in this field with us.
Well, thank
I
you.
also love how candid you are about, what you're still facing in society, in the body that you're in, because I feel like in the eating disorder world, it's a trap that maybe we might be like, oh, and once you're recovered, just like never have a negative thought about your body and like don't care about what society says. And I love that you're like, no, I'm still doing this work in my life. And this is how society views the body I'm in. And I can still acknowledge all of those things and live in a recovered space.
That's right. Yeah, that's absolutely right. Mhm.
So when you use the word grief, it just hit me like right
Mhm.
here
Mhm.
because I feel like we minimize the experience that people have when they live in a body that isn't what is societally acceptable.
Yeah.
And we're using that word grief, like I have chills as we're talking about it, and it truly encapsulates the burden that we
Mhm.
have as people navigating this world with all of these societal pressures and what happens if you don't fit into it.
Mhm. Yeah, I think sometimes grief doesn't even feel like a strong enough word. Um, but I think it's a vital part of the recovery process to be able to allow yourself that space. Like, and when I think about maybe the general stages of grief, I don't know, but I kind of think like in life we just keep going through this cycle, right? Depending on what's going on and what we encounter. And I think the reality of grief is the more you work through it, the more you're able to bounce back, if that makes sense, right? It doesn't have to hit as hard as it did in the beginning. Example, I was actually at a funeral for a loved one last week, and but it reminded me of someone else who had passed 25 years ago, and it surprised me what the amount of grief that it brought, and also like how far my life has come since that person had passed away. Do you know what I mean? And so I just think it's so interesting to think about how our mind and our hearts kind of evolve. And I think that the same thing is true for someone who's recovered or in the recovery process, right? Just because we're on this other side doesn't mean that the world still isn't hard, and that, people don't, say things that really suck, or we get put in spaces that really make us feel othered in whatever way, that may be. And there just has to be room to be sad about that.
Well, we are really sorry for your loss, and we're glad you're
Oh,
here.
thank you. Yeah. Thank you so much.
Yeah.
It's a heavy week, but I love the way that you brought up the topic of body neutrality as well. So a
Hmm.
lot of times people picture recovery and they're like body positivity all the time. And
Yeah.
really what we might be looking at initially is body gratitude. I don't
Yeah.
love my body right now, but can I be grateful that my legs brought me to work today?
That's
Can I be
right.
grateful my arms let me hug my mama or whatever it is?
Yes.
And then maybe we move to neutral. My body might be moving, but my worth isn't moving with it. And so I love that you brought
Yes.
that up because I often see clients feeling like maybe they're failing or like, why don't I love my body yet? And I'm
Mhm.
like, no, no, our relationship with our body is allowed to change. It's a relationship and we're allowed to take care of
Yes.
something even when we don't love it.
Yep, absolutely. I think if we say that we're gonna go from this idea of like body hate to body love, like we're selling a false bag of goods. Is that how you say it? Anyway,
Yeah.
it doesn't matter. But that's not real. Like that is not realistic. And so if that's the picture that we're painting for our clients, I actually feel like we're setting them up to fail. Like I think we really have to look at what is that progression, and also that you don't have to live in body love all of the time to be in a recovered space, right? Like you can have moments and days where you are in this space of gratitude, right? That you're still in existence, as you just said, Maria, or this space of just neutrality. And when I think about what that means, like that space of neutrality, it means I feel uncomfortable in my body, but I do my life anyway, right? Like I may not feel great in these bones, but it doesn't keep me from doing what it is that I want to do, right? And then that body love is like you're just really feeling yourself in that moment, or you're feeling powerful. you know like I think about birthing my children. Like I have never loved my body so much, right, in that hellish 2.5 hours. But it was like my body just did that, right? Like it just pushed out this beautiful being. Like that's incredible. And so I feel like in that moment I had both gratitude and love, you know but then the postpartum body didn't feel that great, and so then you're just living in that space of neutrality again, right? Because it's like I just have to keep going, and I don't want to stop, and I'm not going to allow how I feel in my skin to be the thing that keeps me from enjoying my life, stepping into my life, being an active member of my life, and not just letting it pass me by.
Yeah. Wow. Well, first of all, we make up idioms all the time. So like it's our, on this podcast, I'll be listening like, oh, that wasn't a real thing that I just said. And we love it. We love it. But I noticed we're using a lot of terms, and I was wondering if you could define health at every size for us, because it's
Yeah.
a really important part of eating disorder culture, eating disorder therapy. And I think it's important for our listeners to hear about it.
Yeah, absolutely. So really, kind of the dubbed down version of health at every size is that we're wanting to look at how to live our lives in a caring and healthy way where our body, in terms of weight, is not at the forefront or the goal, if that makes sense. So I think so often when we think about a healthy body in terms of medical status and all of those things, I think the first thought we typically go to is weight, right? I think that's a very common first place to go. And especially for folks who may live outside of the expected BMI, that's definitely where a doctor typically may go first. And so with health at every size, we're really wanting to shift from that perspective to, how do we engage in a life that involves intuitive eating and joyful movement and being respectful to our body and caring for our body. And in all of those ways, I think our body actually really beautifully and naturally responds, right? To create that space of health and wellness in a holistic way, right? Not just this one area, but really from this holistic view, where all of us can be, meaning all of me, can be well, right? And that's really the focus.
The way I like to describe it to clients too, when they're like, "What is this haze approach on your
Yeah,
website?" Is that size is not the indicator of health for us.
yeah,
And I
absolutely.
think as practitioners and clinicians, we need to remember too that the size or body shape that our clients present in does not indicate their severity or their struggle. And I
Yes.
think that's where us in this eating disorder world, we know that. But we're trying to teach haze almost to other practitioners that when our clients go in there, the first thing they talk about is not their BMI. That's not why they're there, right?
Yeah.
But it's so quick for them to make assumptions. It's quick for us to make assumptions too. I'm recovered myself, Mary, and this topic is important to me as well because I found a lot of clinicians made assumptions based off how I was presenting. If I was presenting in my
Mhm.
lower weights, people were like, "Oh, she's struggling." But if I was
Yes.
presenting in my higher weights, people were like, "Oh, she's doing really good." And I'm like, "No, no, no, my mind is really bad right now." And I think that's what we just remember. Size does not equal severity. And
Yes.
that's what we are trying to spread throughout the
Mhm.
whole treatment system of medical doctors and other providers that we work with.
Yes. Yes. I really love that. Can you say that one more time? Size
Size does not equal severity.
Size does not equal severity. I really love that. But I think it's important just to acknowledge that, like, even in the eating disorder space, that has to be remembered, right? When we think about access to care and being able to get our clients what they need and perhaps the amount of care that they need, length of time, all of those things in care, I think that's something that really needs continued education.
I feel like we could do a whole
Yeah.
podcast episode
Oh my God, I'm
on
obsessed.
care
Yeah,
not being
I
based off
we
of
definitely
perceived,
could.
right? We could do a whole podcast. And it's something that man, I see, I have clients all the time, that they get cut early by insurance
Yeah,
because they state that they're not sick enough anymore. And you just told a patient that already thinks they're not sick enough, you're right, you're not sick
yeah,
enough.
that's
And
right.
I think that's where we as providers need to be so well versed in this space to go, I hear what insurance said. They also tried to save as much money as they can.
Yes.
And it does not say anything about your presentation. And we have to be advocates. I'm
Yep.
fighting for somebody right now. They need more time and we're going for it. So we also have to be advocates for our
Right.
clients
That's
when
right.
people are not following this model.
Yeah, absolutely. It's, those top criteria, right? One of those being weight. We just still haven't gotten the memo that that is not the best um, guide, right? For that need for continued care.
One of the most impactful stories I tell my clients is when I used to work at higher level of care. I worked at a residential treatment center,
Mm,
and there was a client who could not be diagnosed with anorexia because her BMI was not low enough,
yeah.
but she was so malnourished, she was on a feeding tube.
Mm,
And that just shows you that, as exactly as Maria said, your weight does not determine severity. And unfortunately, insurance companies and providers and healthcare workers, they see weight as, oh, this is what's normal, this is what's standard, and anything that deviates outside or inside of that dictates
yeah,
health. And we really need to be looking at behaviors.
absolutely. 100%.
Yeah, we need to be listening, not looking. And we have talked about phenotyping important in the past before. Sometimes a severity indicated by weight we cannot ignore,
Yeah,
right? And so sometimes we do have to accept that into the space. But the majority of the time, we have to notice that what's going on in the brain is not always reflected through the body. And when
yeah,
providers pretend that it is, one, even if they, maybe their body did illustrate they need help, well, now they didn't use their words because you didn't make
Mhm.
them say it. You viewed their body and made an assumption. So even us kind of buying into that can do some damage as well. We need to be asking, not just looking.
Yes, absolutely. And it makes me think about, well, two things. Like, one, just how resilient our bodies are, right? Because I think we can have someone who is extremely active in their behaviors and their labs are all normal. And it's like, yeah, because your body is so incredibly used to this behavior, like it's learned how to kind of balance itself out. But when I also think of the other piece to that is, just how high functioning folks are in their eating disorder until they can't be. I don't know why recently I've seen a ton of commercials for the idea of like high functioning depression. I don't know if you guys have seen them.
Yeah.
But it made me think about us, right? Like this idea of high functioning eating disorders, because I think, truly like up until you can't, we are such high functioning, intelligent, individuals, right, who can go undiagnosed for years and years and years, particularly if you are not deemed in a malnourished body, right, in like that typical sense of what we're talking about. And I think because of that as well, we often delay this opportunity for care. And I think medical providers miss it too, right? Because we are just so good at hiding it and going with the flow and doing what we're doing and being successful in our jobs and whatever it may be.
So, Mary Kate, how do you suggest providers support their clients who have experienced discrimination based off of their body weight, shape, and size, whether it is in everyday life or within the treatment centers?
Yeah, absolutely. I mean, I think priority is supporting them and learning how to advocate. Right? So, like, what are those areas of yourself, of your body that, you feel like in your experience have kind of been the most targeted, right? And usually that's weight, right? It's like, well, I go to the doctor's office because I have a cough, and it's like, well, get on the scale. And it's like, well, do you really need to get on the scale to have your cough treated? Probably not. And so, I think about if that's true, then how do I learn how to advocate for myself and say, hey, actually, I don't need to get on the scale today. Like it's actually not necessary. Um, or maybe you're not ready to be that bold, and maybe you learn how to say, hey, I'm going to weigh myself backwards. Like, please don't share, the status or whatever. I stood backwards on a scale for years, and I feel like they all stared at me like I was so weird. And I was like, hey, if I at least am teaching them that this is okay, then maybe somebody else can come in. It won't be so weird for them. But again, just supporting in that advocacy of identifying those pieces that you've already experienced historically that are challenging, that you're going to be walking back into. Does that make sense?
Mhm.
um and like practice and prepare and navigate beforehand how to maneuver through those situations.
This makes me think of the ramifications or the outcomes when providers are not, accepting of this
Yep.
mindset. You
Yeah.
walk in for that cough and then like step on the scale and you're like, okay, I'm here for cough, but sure, I'll step on your scale.
Yeah.
And you're sitting here waiting to be treated for their cough and you're like, have you considered losing weight? And
Yes. Yes.
and I just think of those ramifications of like, whoa, I'm actually now not getting access to the care I need because they're
Yep.
so distracted by my body shape and size. And also, there
Mm.
tends to be some blame associated with that. Whether they're doing it intentionally or not, you're going to feel a finger pointed at you. And I feel like that sort of guilt and shame only just transpires further into the eating disorder.
Absolutely. Yeah. If you can get some of that weight off, I bet your wheezing would be a little less. And it's like, no, actually, it's winter and I have a cough. Can you just treat me, please?
Yeah.
I have this saying that if a provider says that your weight has to change to help you improve your quality of life, that they're a lazy provider.
Mm,
Because I have an autoimmune disorder.
mm,
And the first thing they said was, well, you're in a smaller body. This is all you can do to take care of yourself. And I was like, okay, not enough. Like actually tell me things that I can be doing other than
yeah.
staying in the smaller, thinner body. And
Mm,
I said that to the bride. I was like, that's not enough. You need to tell me how I can actually take care of my body. Because being thin is not the answer that I'm looking for.
Yes. I love that. They're a lazy provider. You're not wrong.
Yeah.
Absolutely. I love that.
Yeah. And I think they're so quick to tell you just how many things you're at risk for being at or above a weight
Mhm.
range, and a weight range is a whole nother
100%.
podcast
Mhm.
too. But slightly being underweight actually comes with so many more downfalls,
Yes.
ramifications, punishments to your health than
Yes.
being at or above a weight range. And
Yes.
most of the time with my clients, I will also see they start to have fear if they're now living in that recovered body or weight restoration was a part of their progress. They're like, oh my gosh, but now my doctor's worried about my
Yes.
cholesterol, or now my doctor says this. And, I can think of a few clients where they've asked, are you feeling tired? And they're like, well, yeah, when I walk up to my fourth floor, I'm tired. And they're like, well, that's an indicator. And
Mm.
I'm like, 4 flights of stairs is hard. And it's just
Yes.
so interesting to me how everything can be pathologized if we're
Yeah.
looking at weight as the indicator. We can
Yeah.
pathologize almost anything. Yeah, breathing heavy, it's definitely not your allergies. Sounds like a weight problem.
Yeah.
You're tired, sounds like a weight problem, not a sleep condition. So I totally agree. Zoe, thank you for sharing that. The lazy, it's like, look somewhere else, not at the
Yeah.
things society pointed to first.
Yeah, absolutely. Well, and I think too, like if you think about the average doctor, I don't know, they see like 15, 20 patients a day, right? And they're just like in there, go, 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 go. And I think about them in that space, they often like don't have the capacity to maybe show up with compassion or capacity to like slow down, right? And they're just like in their rote behavior. And so I think a part of our job and responsibility is kind of shocking their system a bit. And in those moments, like speaking the truth. And my hope would be, that if that can happen enough and they can be impacted enough that their new rote behavior is different than what it used to be, if that makes sense.
And this is kind of what leads us to the concept of weight inclusive care,
Yeah.
right? And I'm interested to hear what are some things that you've noticed in this field or some like misconceptions about what weight inclusive care looks like.
Mm. Yeah, you know, I think the reality is that, historically, you know, eating disorder world was really about the underweight white female, you know? And over the years, we have seen such a drastic improvement to care in that, male, female, all genders, all colors, right, are receiving care. And yet I think we still have so far to go, right? Um, because there is still so much bias, like let's talk about gender, right? Like for a male to for their eating disorder to even be diagnosed, right? Kind of talking about that and for that to be acknowledged, and then like the stigma of what does it mean to get care for myself and how I eat and all of that. Or people within the BIPOC community, and um I think about how many folks I've treated who really struggle with binge eating disorder, and that was completely undiagnosed for so long due to, the medical care that they were receiving. And so, I think it's how do we continue to paint this bigger picture that an eating disorder is not blind to anyone, right? That it impacts anyone and everyone, no matter who you are. There's the option for it to be a part of your life if you have, the predisposition and all of the other pieces that come with it, right? But it's up for grabs to anybody, not just to one person. And but with that, I think we then have to acknowledge, how we treat clinically, therapeutically, dietetically, our language, our conversation. I think about group settings. Like we can't just talk about restricting, but there is like such shame in talking about the binging or even the purging. Although sometimes I think that is sometimes even more okay than talking about the binging or this fear of being the larger bodied client in a room of maybe what is deemed normal size and then perhaps like underweight individuals. And as providers, I think it's our responsibility to create a space in which all of those individuals feel welcome. And I think that's really tricky and challenging, right? Because it means that at some point in that hour, let's say, people are going to be uncomfortable because, we are having to recognize that there are different bodies in the room. And I think that that feels really scary, even as the provider, as the clinician. And so we kind of want to step away or avoid that. In fear of our own faults. Like, are we going to say the wrong thing? Are we going to do, the wrong thing? How do we, and that can't be the thing that keeps us from stepping in. We need to educate ourselves and really navigate and learn from our clients and the worlds that they live in, right? To like expand our own knowledge and growth, and just really able to be all inclusive of anyone who walks into the room.
As you were talking, I got this imagery of almost like sharing the discomfort,
Yeah,
because that is an experience that individuals in larger bodies hold by themselves all the time,
yeah,
just because of the normalization of weight stigma that
yeah.
people just have to experience every single day.
Mhm.
What examples of weight stigma do you see every day in terms
Mm,
of like office chairs or
yeah,
pictures on advertisements? Any
sure. Yeah. Well, I mean, I think office chair you just made me think about is another, huge factor that I think the world doesn't even consider or think about. Um, kind of bigger examples is like an airplane seat. Good Lord, and this reality that, for some folks, they really need to buy two in order to be comfortable. Or you can be on the same airline and be on three different planes in your journey, and the seatbelt fit differently on every single flight. Right? And so on one, it may fit just fine. And on another, you're having to be brave and ask, the flight attendant for an extender. And it's like, what the heck? Like, why can't we just have a seatbelt that fits everybody? Right? Like, this is just so silly. Why do I need an extender? How about we just extend them all? And it's things like that that just don't make any sense to me. Or, the doctor's office, and they've got like the medical grade furniture or whatever, but you can distinctly tell like which chairs are designed for larger bodied folks, right? So you've got like this room of kind of standard chairs, and like every so often you have something that looks a little more like a love seat. You know what I'm talking about? And I'm like, well, why can't we just have all the same size chair, but like a chair that fits everyone, you know? Um, I think I'm gonna get this number wrong, but there's like a percentage that a room is supposed to be designed to meet all body sizes.
Right.
I can't remember what it is. It's like 60%. No, that might actually be too high. I think it's even lower than that. But anyway, just thinking about this, like, well, if we can get up to this percent of furniture to be appropriate for all bodies, then we've done our job. And it's like, well, actually, we haven't. Like, we should be at 100%. And that holds true for spaces that should be inclusive naturally by what we do and who we serve. And unfortunately, that's not always a reality, you know? And then of course you've got social media and all of those things. And you could just like scrolling through, and whether it's you're just seeing all of these like um graphically edited bodies, that we so want, that we just kind of are staring at and people start to idolize, or you're like looking at the next fad diet, or the next shot or patch I saw the other day. I didn't realize they'd gone that far. And so, like, it's just constantly in your face that your weight is a top priority, and that if you do not fit what is expected, then you need to do something about it, right? Like, that is the constant message I think that you can see everywhere.
I think with the airline seat, it actually even makes me think of just like sizes in a store. Why do you have
Mhm.
to ask if you have bigger sizes in the
Yes.
back?
Yes,
Why
that's
is there this giant area that's labeled plus size and then
yep.
every other size goes together?
Yeah.
Why can't we just put them all on the same rack,
All on
right?
the
But
same
it's
rack.
almost
That's
like
right.
it feels like it's like on purpose. And I feel like
100%.
yeah, the way that this world is, I feel as if it is because if they can shame you, then you're much more likely to buy that scale, to buy that measuring tape, to
Yes.
buy that diet food. They
Yes.
just made money off of your discomfort.
Yeah.
And it's hard because we're kind of up against the world in that airplane seat. It can buckle all the way too. So there's no like small limit, right? It can like
Right.
go as far as you'd like, but not out. And
Yes.
they place you in a position that you have to ask. And I whenever I share about weight inclusive care, I sometimes get some pushback. I've heard this asked too many times. So are you like encouraging obesity? And I say, I'm not
Mhm.
encouraging any body size. I'm accepting them all. But I
Yes.
find that so interesting that that's people's reaction that that would be like one, the worst thing in the whole wide world. And two, I'm like, let's
Mhm.
rescale what obese even is. But
Yes.
the next thing is our connection to it. So what if I was? It's not a
Yes.
bad word.
Yeah.
But that's just the question that I hear a lot, even in the like clinical space.
Wow. Yeah. You reminded me of an experience. I like had purchased something online, like an outfit, and went into the store, and they're like, "Oh, we don't carry those sizes in the store. Those are only an option online." So it's like, it's not even a maybe. It's a that is not what we do here. We have created something for something of your kind, but you have to do it online, right? Like you have to have it shipped to your home, try it on at home, and then if it doesn't work, bring it to us. But you can't try something else on. You've got to do it all over again, you know? Like
Yeah.
it's designed to not make us want to wear their clothes, which kind of feels on purpose too.
And what is that communicating? That you can't be out in public shopping here. You have to do it
Yeah,
in the confines of your own home. You
yeah,
can't communicate with us about your needs, that
yeah.
this has to be something that is behind closed doors. Um,
Mhm.
and those small covert things really impact people from being able to just be able to live their life fully.
Yeah,
But
absolutely.
Maria, you said that question of like, are you encouraging obesity? And I look at people like, why do you care?
Yeah,
Like that is not this does not impact you.
yeah.
So why don't you just live your life and they can live their life and your
Mhm.
health is not their health is not your concern. Their health is my concern because it's my client.
Yes, yes, yeah. Like your concern should be, creating a space for everyone.
Mhm.
Yeah.
I think too, what people don't realize is I think there's this assumption made that people living in larger bodies all want to lose weight.
Mhm. Yeah.
And I think there's so many actually people out there that are happy in their bodies. And if they present on my couch and they want help with their relationship with food or maybe anxiety, whatever it is,
Yeah.
I'm not going to recommend weight loss, even if I
Yeah.
will say the way I run my practice when people have a goal of weight loss, I try to make the goals more intentional of like, can I better my relationship with food? Can I feel happier?
Yes,
But
yes.
people are like, I don't understand why you wouldn't recommend that to somebody. And
Mm.
for me, I usually reflect to them, oh, I really wonder what's going on for you. What kind of, environment did you grow up in where you feel so strongly about body image and sizes of people you
Yes.
don't know?
Yes. And that body and size is the solution for happiness, right? That body, the size of your body, um, equates to the amount of joy you get to have, like in your life, and fulfillment and success, and all of those pieces. And it's like, well, actually, I think if we shifted away from that, right? And as you were saying, Maria, kind of like strategizing about more specific goals, like what you're speaking to is like, how do I create a well-rounded, joyful, intuitive, present life? How do I create a space where I can be a part of my world, be engaged with it, um, decrease, those anxiety symptoms and depressive symptoms and all of those things. And often, a lot of that comes with being able to reintegrate into your world and find community and acceptance and relationship and all of those things. And in all of that, I never mentioned how much you weigh on a scale, right?
Yeah. Aside from weight loss goals, how can providers be more affirming for folks of all sizes?
Mm, yeah. So I think I kind of going back to what Maria just said of like listening to what it are the goals that they're coming in for, right? Because maybe they do come in and say I want weight loss, and so that's something to negotiate and talk about. But if that is not what their presenting issue is, then that's not what we should be talking about, you know? And so if they are coming to us for depression and anxiety, then let's really dig into why all of those things exist, right? And how do we help them navigate that? And things like that. And I think naturally, honestly, I think the body will always come up, right? Because we live in our body, like we're not ghosts. And so it's gonna come up in some way, shape, or form, you know? So I think like it will find its way. And when it does, then like just show up with like compassion and validation for their experience and like support them in what they are experiencing. And you really have to learn to work through your own weight stigma, right? And your own like backstory and history of what you've been taught and told, so that that is not what you are then like imprinting on your client. You liked that ghost thing,
A little
huh?
too much.
Really?
I'd never heard it before. And
I
I
have never heard that, and I will be using that in my practice. I loved that.
I don't think I've ever used it before either. It just came out.
I love it. I love it so much. I'm very sassy with my clients. So I'm gonna be like, are you a ghost? Like, should you just not have a body? I
Yeah.
love it.
Sometimes that feels like it'd be really helpful, you know?
It's actually a good question. Yeah, like how would your life be different if you were a ghost? Oh,
Oh,
we could go down a whole
100%.
thing. But that'd be very
100%.
interesting. Yeah, if nobody
Yes.
else could see the body, you weren't experiencing a body.
Yes.
I really, yeah, you got our wheels turning on that.
Yeah, that's actually a prompt I've done with clients. I didn't use ghost. I used soul, which is a little more, compassion, life oriented, I guess. But yes, like what would life be like if it was just our souls like floating around, you know? Gosh, it'd be a different kind of world, wouldn't it? Yeah.
Yeah, we all just kind of like sunk into that because I can picture, I think a lot of pain would be lifted for a lot of people.
Yes. So much.
And to like follow this like soul morbid ghost path, like what's written on your like tombstone or your obituary is not
Yeah,
going to be how much you
that's
weighed.
right.
It's
That's right.
going to be what was the soul.
That's right. That's exactly right. Like, our bodies are a temporary entity, right? That are carrying around this soul that is just so incredibly beautiful and um, you know, created in such a way that's like unique and just yours. And like, what if we could just really step into that, you know? And yes, we need to care for our body because it is what is carrying us around in the world, right? Um, but again, it is not the thing that needs to be at the forefront. It's what our heart feels, it's what comes out of our mouth, right? It's, what our minds are thinking and creating. And that's what builds connection and relationship. And I think that's such a priority in the life of a soul.
You mentioned like and we do need to care for our body. And someone in my circle said that she added something onto haze, that not only
Mm,
is it just health at every size, but it's also health seeking at every size. And no
mm,
matter what size you are, you can engage in behaviors that takes care of your body.
that's right.
And I feel like especially in the fitness space, there is a lot of
Mm,
discrimination against,
mm,
people of a larger body size in the gym. And it's like, hey, it is okay to be any size, any shape, and engage in health seeking behaviors.
yes, absolutely. Yeah, and I think, we have to broaden our definition of health-seeking behaviors too, right? Like that joyful movement can look like so many different things for so many different people, and for some it might be the gym, like, and that feels like a really good space. And for others it may be, I don't know, playing pickleball, or that's like all the trend, or running with your kids at the park, or swimming, or you know
Moving.
going for a walk. Yes, like just moving, meeting a friend for a coffee and a walk, like that sounds lovely. So just in we are designed to move. I had someone one time say, like, our body is designed to move. Like we are always like facing forward, like our knees face forward, like we are designed to keep going. Right. And which I think is a really beautiful picture of like life and recovery, is like we are designed to keep moving forward, but our body is designed that way. And so how do we engage in a way that allows us to keep moving, for sure?
And I think it's important as providers that our recommendations that we give to clients is not a behavior of another disorder. So
That's right.
unfortunately, I don't abide by this, but what I have seen when people come into my doors, what they've had in the past is if they were maybe restricting heavily, they were almost prescribed binge type behaviors.
Oh,
If
wow.
they were binging, they were prescribed restrictive type behaviors. Or
Mhm.
I've also seen if they were existing in larger bodies, they were prescribed much more movement or exercise goals than I have seen my clients that present in at or below their weight range.
Mhm. Mhm. Ugh, yes, I think that's very real. And I think that goes back to the work of ourselves as the provider, right? Like, what is it intrinsically in us that leads us to feel like that is the right choice, right? Or the right solution in providing care to our clients.
We all have to be reflecting on what biases we bring in because we all have
100%.
bodies. We are not all
Yes.
ghosts. So
Yes.
we all should be reflecting on how we take up space, how we believe others should be taking up space, and how that
Yes.
impacts our therapeutic relationships.
Absolutely. It makes me think about oh gosh, is it the Harvard biases test?
Oh
You
yeah,
know
the
what I'm talking
implicit
about?
bias test.
Yeah,
Yeah.
yeah. Okay, so every time I've taken it, I show a bias to weight. Like, and I have so much shame, honestly, around the fact that that's true, because I am a fat person in this world. And yet when I take that assessment, like, I clearly have work to do. And I think it goes to, I've got 39 years of life that I've also lived where, I was taught from a very young age what the expectations are, right? And what to believe. And did not grow up in a community in which the way I choose to live my life now was acceptable. And so, like, that's a lot of years to unwind. And it's a lot of years and beliefs and practices to have to renegotiate with yourself, and to be intentional about addressing and changing, but I think it's important to just name that, because it's like we all have it, right? Like we all have our biases, and they're gonna pop up sometimes in ways we're not even expecting. And I say I have shame about it, but the reality is, like, I'm not a bad person because that happens. I'm not a bad person because that is you know at times where my mind goes. It's instead looking at and examining why, and then how do I do it differently? Like, how do I change my perspective and renegotiate with myself so that I can show up differently and better, right, for my clients? I think it's interesting for me. I feel like within the eating disorder space, I do a really great job of not allowing that stigma to kind of step into my world. But it's like then you go and live your normal life and you're not in like clinician mode, if that makes sense. And I think that's really where it can show up. And it's like, how do we create a practice in which we can show neutrality for everyone and acceptance of everyone all of the time, no matter what. Yeah.
I think you bring up a good point, of even like kind of the almost I'm hearing the pressures that we face because just what you said, I feel shame that I have a bias, and we're like, you're human,
Yeah.
you have implicit biases. But I do feel like as ED providers, we're expected to one be statues, body's
Yes.
not supposed to be changing, we're supposed to have
Right.
zero biases, just completely disregard the world we've grown up in. That
Right.
doesn't apply to you any longer. We're not supposed to have any negative emotions towards our bodies, or like all of these things. And we are humans. And
Yep.
so I'm really glad and I appreciate your candidness that you're like, I have a weight bias because we all could raise our hand for something that the ED world would shake its head at and say, like, basically fix it. And I think we can show neutrality even with ourselves. We're
Mhm.
not perfect. We're not expecting our clients to be perfect.
That's right.
The other thing I think of when you say you had a weight bias is that I actually try not to even make an assumption on which way that goes because I've actually had some clients that exist in fat bodies that are really attached to the fat identity. And of course,
100%.
what I want to work on with them is them still being a little bit more neutral about like their body not indicating their worth. But people would be like, I think people would be surprised that I have a lot of clients that are like, no, I'm like losing weight and I don't want to. And the
Yes.
rest of the world would say, good job. And they feel like they're actually losing a piece of themselves they loved. So I
Mhm.
think there's that perspective as well that not everybody has the same brain or the same bias, and not everybody feels the same way towards the word fat. Some love it.
Yes, absolutely.
Like,
Absolutely. I actually really love that point because I think there's been such a shift in this, kind of like fat liberation and that identity. And but I think what's important to what you're naming is like I think the work is that we can't oscillate all the way towards one side or the other, right? Because if we live in a space where I don't know, like there's a difference between like owning and loving our body, like of that size, and that leading to the disrespect or potentially hatred towards another body type. Does that make sense? Right? Like we can love ourselves well and love the bodies that we're in without negating what somebody else's body is. Right? And I think that's really important.
That is so powerful. And
Mhm.
I love that we're saying the word fat because I feel like a lot of people think it's a bad word. No,
Yeah.
it's just a word, just
Just
as
a word. Yeah.
and if someone uses themselves, oh, I've seen people respond on intakes of like, oh, tell me about yourself. And they'll respond, I'm thin, I'm fat. It's like, that doesn't tell me anything about you. I
Yep.
want to know who you are.
That's
And
right.
that is just a one aspect of you. There are so many different beautiful parts of you that I want to get to know.
Yes.
Mary, yeah, I think Zoe and I both just loved that sentence that you had said. That's probably one of my favorite sentences that you did say that we can love our bodies, but not have it negate from the bodies around us and such.
Yeah.
But agreed on the word fat. I'm really glad that we're just using it because it's like I've even seen in my personal life somebody saying something about them being fat, and somebody said, "Don't say that."
A
And it's
hundred
like
percent. Mhm.
it's like what does that mean? It was a descriptor word, but
Yes.
we've like demonized it in this society, and people are scared almost to use the word that we can use a descriptor just like we
Yeah.
used then, just
Yeah.
like
Well, because I mean, historically, fat is like a bully word, like it's like I picture, oh, that's a terrible picture. Like I picture like a kid on the playground, and somebody pointing at them and be like, oh my God, you're so fat, right? Like you can see it. And so I think that it is such a transition to utilize the word fat in a neutral body descriptive way. You know, I think I've had to go on that journey myself of like, oh, how do I feel about calling myself fat? Like, am I comfortable with that? Like, how do I feel as that being a descriptor that I use for my body when it was something that I was told many a time in a way that was so incredibly hurtful? And I think for some of us, it's like a way of almost like taking the power back in a way, right? And like, kind of diminishing the power of the word, right? And it like just becoming a descriptor. But I think it's really important to take the guide from our clients of like what they're comfortable using. Like I think for myself, I oscillate like between larger bodied and fat, depending on who I'm talking to and my environment. Um, but for some of our clients, that might not be where they're at or what they're comfortable saying, and maybe that's a part of their work. Not that they have to walk around saying, "Hi, I'm fat," but just to like take away that demonizing sense, of that word in life and space. Mhm.
Well, what an amazing place to wrap up, to recognize that
Yeah,
we are so much more than just our bodies. And
absolutely.
again, we're not ghosts. We
Oh,
have souls, we have bodies, we have
that's right.
so many different qualities of ourselves. But thank you so much for joining us today. We want to give one special, again, last shout out to Alsana. Alsana is an eating disorder treatment center with locations in Alabama and California. They also have virtual IOP programs, and they also have a teen program, which is really great. And now you have a face to the name. We have Mary Elizabeth coming from
Yes.
Alsana. So for our listeners, if you are looking to go to treatment at Alsana, this is a person that represents their community, and what an amazing person that they have.
Oh, thank you guys so much. It was such a pleasure to be here today. Thank you for having me.
Thank you so much, Mary. And wherever you are, whoever you are, take a seat with us.